CPCA Practice Test 2026 Certified Personal Care Aide Exam Questions and Answers Home Health Training. Question 1. What is the primary role of a Certified Personal Care Aide, CPCA? Diagnosing illnesses, assisting with activities of daily living, ADLS, performing surgery, prescribing medications. CPAs assist clients with daily tasks like bathing, dressing, and eating. Question 2. Which of the following is an example of an ADL? Paying taxes, bathing, driving a car, fixing a computer. Bathing is a basic activity of daily living. Question 3. When moving a client, what is the most important rule of body mechanics? Bend at the waist, lift with your back, keep your feet close together, lift with your legs and keep a wide base. Using leg muscles and a wide base prevents back injuries. Question 4. True or false, a CPCA should always wash their hands before and after client contact? True. False. Hand hygiene is the most effective way to prevent the spread of infection. Question 5. What should you do if a client falls? Pull them up immediately, leave them and go home. Stay with them, call for help, and check for injuries. Tell them to be more careful. Safety and assessment are the priorities after a fall. Question 6. What is incontinence? Inability to sleep, inability to control bladder or bowel movements, loss of memory, difficulty breathing. Incontinence is the involuntary loss of urine or feces. Question 7. The best way to prevent pressure sores, decubitus ulcers, is to apply lots of lotion, turn and reposition the client every 2 hours, keep the client in one position, give them extra vitamins. Regular repositioning relieves pressure on bony prominences. Question 8. What is HIPAA? A type of hospital bed, a law protecting patient privacy and health information, a nutrition guide, a certification for aides. The Health Insurance Portability and Accountability Act ensures patient confidentiality. Question 9. When assisting a client with a weak side, example, after a stroke, which side should you dress first? The strong side, the weak side. It doesn't matter. Both sides at once. Always put on the weak dress the weak side first, and take off the strong. Question 10. A clear liquid diet includes milk and orange juice, apple juice, broth, and gelatin, mashed potatoes, steak. Clear liquids are those you can see through. Question 11. What is the normal range for an adult's resting pulse? 40 to 60 bpm, 60 to 100 bpm, 100 to 140 bpm, 120 to 160 bpm. A normal adult heart rate is typically between 60 and 100 beats per minute. Question 12. How should a CPCA respond if a client is angry? Argue back, ignore them, listen calmly and try to understand their feelings. Call the police. Empathy and active listening are key to de-escalation. Question 13. What is the Fowler's position? Lying flat on the back, lying on the stomach, sitting upright at 45 to 60 degrees, lying on the side. Fowler's position involves the head of the bed being elevated. Question 14. When performing perineal care, you should always wipe back to front to back, side to side, doesn't matter. Wiping front to back prevents the spread of bacteria from the anus to the urethra. Question 15. Which is a sign of dehydration? Dark urine and dry mouth, clear urine, excessive sweating, high energy. Dark urine and parched lips/mouth are classic signs of fluid deficiency. Question 16. If a client has a NPO order, it means nothing by mouth, no personal objects, new patient only, nutrition per orals. NPO stands for nil per os, meaning the client cannot have food or water. Question 17. The first sign of a pressure sore is often a deep hole, redness that doesn't go away when pressed, bleeding, a fever. Non-blanchable erythema, redness, is a stage 1 pressure ulcer. Question 18. True or false, you should use a client's razor on yourself if you forget yours. True, false. Personal items should never be shared to prevent cross-contamination. Question 19. What is aspiration? A goal for the future. Inhaling food or fluid into the lungs. A type of bandage. Deep breathing. Aspiration can lead to pneumonia and is a major risk during feeding. Question 20. A gait belt is used to hold up the client's pants, assist with walking and transfers, measure the client's waist, restrain the client. A gait belt provides a secure point for the aide to hold while assisting a client.